My name is Diane, and I'm from Frankfort, Illinois. My age is 79, and 2 years ago, I had experienced severe pain in my hip that went down the leg, past the outer knee, and down, well, I should say down the hip, past the outer knee, and down the leg. I went to my orthopedic specialist, and he had put me through an MRI, and was very surprised because I had a torn ligament there, and he kept questioning me as to whether, he said, you must have fallen or hit it severely or something for that to have happened, which I never did. So he was very concerned about it because he knew that surgery would be very extensive to repair that. So I kind of went along. I had to resort to walking with a cane because every time I took a step, I felt like I was going to collapse and fall, which was very annoying because I was a walker. I used to walk 2-3 miles every day, and I could hardly walk a block or 2 blocks with this issue going on. I went to another doctor for a second opinion, and he had put me through physical therapy, which did not work. Heard about another orthopedic specialist that was very good in dealing with this problem, and went to him. He explained the surgery to me, which would have been horrific. I would have had to be off my feet like 2 months, could not step on my foot at all once the surgery was completed. And with living alone, that would have really presented a problem. My son is a chiropractor, and he had heard about the Smart Institute and Dr. Vogt. He had a couple of patients that had gone to him for this embryo stem cell transplant. So went to Dr. Vogt, was very impressed with him and with what he told me could have happened. And his first question was, were you on Cipro? And I said, yes, I was. And he said that is one of the reasons that is causing this tendon to separate like this. And I was very impressed with him because I had gone to 2 orthopedic specialists, and they insisted I must have either fallen or bumped into something and injured the tendon. Anyway, had gone through the treatments that he recommended. I can't say that the injections were painful, but just the position I had to lay in was painful because of the fact that I did have the torn tendon. And the healing was gradual, but it was very impressive because all of a sudden I'm thinking, wow, I can do this and I can do that. I can walk longer than what I used to walk. It wasn't like I jumped off the table and was able to run a marathon or anything like that. It was a gradual process and a gradual healing process, but now I'm back to walking my 2-3 miles a day, very impressed, without pain. So I would highly recommend Dr. Vogt. He just did wonders with me. After the stem cell injection, I believe Dr. Vogt had me come back the following week, and then it was a monthly visit. And he talked to me about the improvements that I was having. And of course, every time I came in, I was just delighted because I was able to do something more over and above what I couldn't do when I was dealing with this. And he did say that it would take a good 6 months to a year because the stem cell is regrowing the tendons to reconnect them. And so just to be able to walk longer than a block or 2 blocks, to walk without a cane was just fantastic because of the fact that, like I said, I had been always very active and everything. Now my next appointment is, I haven't seen him probably for about 4 months. My next appointment is in January, mid-January. So we'll talk about my progress then. And considering the surgery I would have had to have gone through, and really there were no guarantees with that surgery either. So I was more than happy to have done the stem cell with the embryo, and am very pleased with it. It was minimal, the amount that I had paid Dr. Vogt to have gone through this, and I was more than happy to do it. I find a lot of people also, they can take 2 trips a year, but when it comes to their health, they think twice before spending the money. And in my heart, I said, well, why don't you just give up a trip a year and think of your health first? So I know a lot of people my age, a little younger, a little older, and I have recommended a couple people to Dr. Vogt, and they have been very pleased. It's been wonderful.
When Diane came to me, she had already had a year's worth of hip pain. She had trouble walking. She would have falls due to the pain, and she walked with a cane. She had seen a few different orthopedic surgeons, one that recommended against surgery, one that recommended surgery after degenerative tendon tears were seen on the MRI. We performed a diagnostic ultrasound in the office. We reviewed her MRI, confirmed essentially that she had degenerative tendon tears. She didn't have any trauma, which was odd. But we investigated whether or not she'd been on certain antibiotics that may have caused a tendon injury. And in fact, she was. She had taken, prior to her onset of pain, she had been taking certain antibiotics that had been indicated to cause tendon injuries. We performed a stem cell injection under ultrasound guidance. In her case, we used not her own stem cells, but from umbilical cord tissue. And by 2 weeks, she reported over a 50% reduction of pain. Her pain level when she came to see me was 8 to 9 out of 10. After 2 weeks, it was already down to a 3 out of 10 pain level, and it exceeded my expectations. By 3 months, she was reporting minimal pain, walking without a cane, and going, she had just been on a walking tour with her friends in downtown Chicago. I treated Diane 1 year ago. She's 1 year out from that procedure now, and she's still doing well.